Welcome back to San Antonia Living. If you've got kids, it may be time to consider a mommy makeover. I know that even I have considered some sort of makeover at some point, and so have all my friends. And so joining us to tell us a little bit more, Dr. Decherd is here with the San Antonio Plastic Surgery Institute. It's very good to meet you. Thank you for coming today.
Thank you for having me.
I've got girlfriends under 30 years old with kids who we have sat around and we've talked about what we need to do. You know, we might look good on the outside, but everybody's got a secret, especially those of us that have had kids. So you offer something called the Mommy Makeover. What is that all about?
Well, it's kind of a general term, but it talks about women who have had kids doing things to try to roll back the clock a little bit and restore their body to kind of a pre-pregnancy state. Now, obviously, you can't do that exactly, but I see a whole lot of women who have had kids, and they sort of feel like, gee, women who get plastic surgery must be sort of different or looking to look real obvious, but a lot of women who have had kids just want to kind of roll it back in and are kind of surprised that they're seeing me almost. And so,
well, and you know, people, when you have kids, you're a little bit shocked what your body comes out looking like after you delivered that baby. And it could be someone who is in perfect shape going into labor, coming out, something goes wrong.
Well, and I see people who are gym rats, who are in great shape, who have no body fat, but they don't realize that their fascia has been stretched out over their abdomen, and their skin is loose, and a lot of women get stretch marks, and there's no cure for that. So we can excise some of that skin and make it a whole lot better.
And it's a big confidence downer when you have a particular area of your body that you're not happy with. Do you see women who completely change after they've had work done?
Oh, it's the biggest rush for me to see the difference this stuff can make in people's lives. Everybody understands the physical changes, but the emotional and mental changes and how people feel about themselves, they just have a new confidence. It's really fun.
And you know, you don't have to, this is something too, a lot of people think plastic surgery, well, immediately I'm going to come out with things much bigger than they were before. But you don't have to aim like that. You can say, I just want to be what I was before, nothing bigger, no different, and you can go in moderation too.
Well, absolutely. There's a role for the degree of change that we want to make.
Right.
And so some people only see extreme personalities, and that's a very small part of a bigger pie of people who just look good.
Well, let's take a look at some before and after pictures, because it's pretty amazing the transformation that women go through. And this is, again, someone who is very thin to begin with and just has that tiny little tummy pooch that I'm sure they wanted to get rid of, and it's amazing the transformation.
Yeah, and so, you know, loose hanging skin is something that's not going to be fixed with exercise. And so, yes, there's a scar, but we like to get it low where it'll hide under either a bikini or underwear, and you know, these people feel much better about themselves. They can wear form-fitting clothes that show off their body as opposed to clothes that are kind of loose to try to hide their body. We're showing tummies here, but there's a role for breast surgery and a lot of liposuction perhaps as well. So
a lot of women come out of breastfeeding with a completely different rack than they went in, and women wonder if you can get it back to what it used to be, or will they continue to, can I say sag? I can say sag. I can do whatever I want, right? I mean, how do you fix that?
Well, you know, volume loss and sag are a little bit different, and so if you're missing volume, you need to add volume, and that's usually an implant. If you just need to reposition things and perk things up, then that's usually a lift, and that's going to involve some scars, but it's, you know, so not everybody wants to do that, and that's fine, but the people who do want to do it and get it done are usually pretty happy.
Where does the volume go? Who took it? What happens there?
Well, you know, the breast is a gland. It makes milk, and so over time, and it's weird because some people look fantastic afterwards, but other people lose all their volume, and so in the meantime, you stretched out the envelope, you've lost the volume, and now things are kind of deflated and saggy, and so sometimes by adding that volume back, and it doesn't have to be a ridiculous amount of volume, they are restored to kind of their pre-pregnancy state and feel better about themselves.
What about stretch marks? That's another common birth problem. Can you help with that?
Well, you can't fix stretch marks per se, but most of the stretch marks I see are on the abdomen, and they're from the belly button down, and that's the skin that we take out in a tummy tuck, and so, you know, there's a scar down low now, but it can hide, and so the lower abdomen is usually, you know, you usually take out most of the stretch marks.
What if someone goes into this thinking, oh, I'm going to look just like I did when I was 20 years old? Is that realistic?
No, and you know, you're not 20, so the goal is to look good and to feel good. It's not to look like somebody else or to look like you did when you were, you know, 20 years ago.
Well, I love your approach. It's very realistic, and you're very upfront too with letting us know what we can do and what we can't do and how it's all going to it'll work out. So thank you for coming today.
Well, thank you for having me.
We're all moms around here, so let me give you the information to find Dr. Decherd. He is at San Antonio Plastic Surgery Institute in the Stone Oak Medical Building on Madison Oak. If you've got questions, you can certainly call him to set up an appointment at 210-495-4100. You can go online to drdecherd.com for more details.